Welcome back. Let's take a look at more news now. Traditional healers in the Eastern Cape are voicing a strong opposition to the proposed Traditional Health Practitioners Act, which they say threatens to undermine their spiritual practices and cultural beliefs. Now, the bill, which aims to regulate the sector, has been described by many healers as an attack on African spirituality, as it seeks to impose government policies on practices that are largely rooted in ancestral communication as well as spiritual guidance. We have roped in a traditional healer, Phuthumile Funani, for this discussion. Ndlondlo, thank you so much for agreeing to talk to us this afternoon. So this act has largely been in effect since 2007, but it's the new proposed amendments that are actually being disputed, such as the registration of traditional practitioners, as well as the minimum standards for training. Tell us more about some of your concerns.
Good afternoon, Sasas and the listeners, and thank you for offering me this opportunity. The Act, yes, the Act was active since 2007, which is now, that is why it's called Act 22 of 2007. And if you start there, the problem starts from the Act itself. That is why there has been a long hold on implementing what is in the Act. You will remember that the Act itself is a problem. That is why we have been discussing with the department, with the previous ministers, to stop or try and mitigate the right way to implement what is on Act 22 or to revise the Act itself. But that fell on deaf ears because the department carried on implementing now the regulations, which is what we're speaking about since June of 2024. And you'll remember that they were now the regulations were gazetted since June, the 1st of June 2024, and the closing date it was 21st of September 2024, where they even gave us an opportunity to submit our comments. And we did that, and on top of that, we have called the interim traditional health practitioner to come to us because of the manner in which they conduct consultations was incorrect. It was exclusive because they called a few individuals into exclusive places like the hotels and any other places where most traditional healers were not able to attend. And then they refused to adhere to that call. And then we ended up marching, trying to voice out our complaints, the department itself and the minister. And we submitted memorandums in different provinces and in different institutions. The government itself, they never responded to those comments. They never responded to the memorandum. And then we just, by shock, we had them on the news saying that they are going to implement the regulations because of the healers happy. Then we want to know which healers are happy and which healers are now agreeing with now this suppressive regulation. Because now the regulations take us back to the apartheid times where our fathers, our forefathers, and the rest of the community of the healers were suppressed by the Witchcraft Suppression Act of 1957. So we feel that Act 22 of 2007 is still now a revised version of Act 3 of 1957.
All right.
So we do not.
Yes, Ndlondlo, I just want
accept the regulation.
Yes, Ndlondlo, I just want to get in there. You say you've been in consultation throughout this consultative process, right? And I understand this was actually before even elections, before the new government of national unity was actually installed. Have you tried to reach out to the relevant authorities after the installation of the new administration? Because as we've seen, there has been promises under the new administration that traditional affairs will actually be accorded the much necessary attention.
You remember that our march was on the 13th of September, which was now after the government of national unity. And we handed over the memorandum during that time.
Okay.
But then the government, the state itself, they ignored those memoranda because of now they're talking of implementing the regulations early 2015.
All right. Ndondlo, who did you submit your grievances to?
The Eastern Cape submitted the grievance to the Department of Health here in the Eastern Cape.
Okay.
And there were people who went to Pretoria to submit the memorandum to the Minister of Health.
All right, so it was the Ministry of Health. We're going to try and definitely get some feedback or comment or reaction as to what you are alleging now. But Ndondlo, in what ways do you feel that the proposed amendments will actually impact or disregard these practices that we know are largely rooted in sacred ancestral origin Tonga? Are they not then ensuring better compliance and regulation in order to deal with the latest trends of fake gobeles, as we've seen?
There's a lot of things, man. The terminology first that is being used in the document does not describe or define the sector. It's very problematic, and in the long run, it will cause problems where now our people will be confused by the terminology and end up being prosecuted or arrested because of the act, the regulation itself. They're talking about arresting people, and they're talking about now sentencing people. So if the terminology is not correct, then it means then the regulations are incorrect because of they are not defining who we are. The things that are put there, and they are very high. We don't know how people are going to cope with that.
All right.
And two.
Yes, Ndondlo, very quickly.
And going forward, ma'am, you will also understand that the context in which the document is designed is from the Western perspective, not from what we understand. Because it talks about the education qualification, which does not apply into the sector of traditional. You do not have to be educated in all.
All right, Ndondlo, thank you so much for talking to us. I mean, I think you were making reference to that accreditation system for trainers and training institutions for traditional practitioners that is being proposed under this new legislation. Phuthumile Funani, a traditional healer there on the proposed amendments to the Traditional Health Practitioners Act.